Initially, we sat down with the architect and we looked at the individual room designs and laid out where the equipment would be, how the room would be set up. But what actually enhanced the whole design process for us was the use of virtual reality. An architect brought in equipment and staff were able to put on goggles and walk around the building, and that gave them a sense of space. It allowed for us to change some of the design aspects, just small things that made a difference about where equipment would be, and it also gave staff a sense of how the space within the corridors and how the patients would feel walking around that area. So we created a bespoke sterile cart. Staff will take the inner carts and take what's needed for the first theatre list and take them straight into the prep room. Not only does this reduce the amount of resources and time, but it also improves for infection control, that we're not handling packs, there's less chances of the packs being damaged and they're stored in the correct manner. What was important for us was that we maintained patient experience and patients were able to walk through to theatre, but at the same time we had an efficient flow as well, managing to keep up activity. What was also important was that we had sight of what was happening within theatres, and that's where we decided we would have a glass screen between two of our theatres. It supports what we call our double lists. Some of our surgeons will move from one theatre to the other using the shared scrub area, and they're able to see what's happening in the next theatre and at what stage the patient's at. The building's enhanced with use of lots of natural daylight, which provides a great environment for patients, but it's also beneficial to staff, especially staff working within our theatres. But we also use a lot of daylight and glazing within our public areas and our main entrance, which gives a good sight of the rest of the hospital. In addition to working with the clinical staff to get the design right for our patients, it's also important that the wayfinding in the building is easy and accessible to all. So a lot of patients will have visual impairments, and we want to make their journey to the hospital as seamless as possible and be able to find where they should be going easily. The use of the self-check-in enhances that, but the wayfinding lines and the signage across the unit again enhances that experience for the patient as well.